Hello, my name is Maria Cordero, and today I'm going to be talking about type 1 diabetes. So, what is type 1 diabetes? Type 1 diabetes is first and foremost an autoimmune disorder. Its name is diabetes mellitus, DM, and there are two strains of diabetes, type 1 and type 2. In this case, we're going to be talking mostly about type 1. And essentially, diabetes is when your body can't produce enough insulin, or the insulin that your body produces is not as effective as usual. So, this causes your blood glucose levels to get too high. So now for some characteristics of diabetes. Before, diabetes is a metabolic disease that involves super high blood glucose levels due to not enough insulin in your system. There are two types of diabetes, and I think it's really important for us to kind of know the difference between both of them. So for type 1, this is whenever your pancreas does not make insulin because the body's immune system is actually attacking the cells that the pancreas needs in order to create the insulin. And for type 2 is whenever your pancreas makes less insulin than you're used to, so your body becomes resistant to insulin. Type 1 diabetes is organ specific. It affects insulin producing pancreatic beta cells in the pancreas after an inflammatory process, and this leads to a chronic deficiency of insulin. I think you can probably tell by now, but the main organ we're going to be talking about is the pancreas. So diabetes responds to the innate immune response signaling, and the Th2 cells stimulate IgM, IgG1, and IgE synthesis by B cells, and that activates eosinophils, promoting hypersensitivity reactions. Type 1 diabetes can be lethal. If not treated, it can lead to a diabetic coma and can result in death. Over time, type 1 diabetes complications can affect major organs in the body other than the pancreas, including heart, blood vessels, nerves, eyes, and kidneys. Now let's talk about the incidence. So in 2021, diabetes was the 8th leading cause of death in the United States. The number of people in the United States who were diagnosed with this was 1.3 million adults, a total of 38.4 million people yearly with both type 1 and type 2 diabetes. The number of cases worldwide is 8.4 million, with 1.5 million being younger than 20 years, 5.4 million being aged 20 through 59 years, and 1.6 million people aged 60 and over. Number of cases who have died in the United States have been 103,294 people, with 13.2 people per 100 males and 9.9 per 1,000 females. For the number of deaths worldwide, it has been 35,000 non-diagnosed people and 1.8 million diagnosed. It is estimated by 2040 that 2.1 million people are expected to be diagnosed with type 1 diabetes. Unfortunately, diabetes is growing at a rate of 2.9% per year versus a population growth of 0.8% per year. So, next we're going to talk about the historical perspective. Diabetes goes back to the Egyptian times. Over 3,000 years ago, the ancient Egyptians mentioned a condition similar to type 1 diabetes. The symptoms they included in their manuscripts were excessive urination, thirst, and weight loss, which are some symptoms that we will later describe in this presentation. In 1776, Matthew Dobson confirmed that urine tasted sweeter whenever it contained high sugar levels, confirming that that person had diabetes. And in 1936, Sir Harold Percival Hemsworth published research that differentiated between type 1 and type 2 diabetes. They did eventually come up with some treatments, narcotics like opium, fasting and using a carb-free diet, using rancid animal food. They also emphasized on lifestyle changes like wearing warm clothing, taking baths, including cold baths and Turkish baths, avoiding stress, wearing silk or flannel, and obviously exercising. So this is Sir Harold Percival Hemsworth. I know you guys are dying to see what he looked like, but yeah, he was the man who differentiated between type 1 and type 2 diabetes. So this is actually the first insulin bottle that was used to treat Leonard Thompson. He was 14 years of age, and it was on January 1922. Because of this, he was able to live another 13 years, and this was whenever everybody realized that insulin was the way to go. So now let's talk about the mechanisms of induction of type 1 diabetes. First, we have the immune response. This is where infiltration of isolates of Langerhans occur, and this is where beta cells reside and are activated by autoreactive T cells. They do have molecular mimicry, and it involves the activation of autoaggressive T cells in TID as a result of virus carrying an epitope that strongly resembles the certain structure on the beta cells needed in order for this to occur. For the polyclonal B cell activation, it involves a pathogenic role in disease through production of inflammatory cytokines and the presentation of autoantigens, in this case, the T cells, in which consequently induce a cross-reactive immune response that eliminated not only the injecting, but also the body's pancreatic cells. Is this genetic? Genes can make some people more prone to getting type 1 diabetes, but just because that person has the genes, it doesn't necessarily make them like for sure that they're going to get the condition. So next, let's talk about B cells. So about 70% of the newly produced B cells in your bone marrow can bind to self-antigens. They do this to prevent autoimmunity. These self-reactive B cells need to be dealt with, and so that's why they are able to bind to the self-antigens. In the bone marrow, self-reactive B cells processes like receptor editing. This involves rearranging the genes that encode the B cell receptor to alter its specificity. This process helps to eliminate autoreactivity in many cells. The B cell will undergo apoptosis if the receptor editing fails to eliminate strong signals from self-antigens. And the peripheral tolerance in B cells that lack autoreactivity migrate from bone marrow to peripheral tissues, and the peripheral tissues become mature, naive B cells that participate in protective immunity. So now we're going to talk about T cells. Type 1 diabetes is a result from a T cell mediated autoimmune destruction of the pancreatic beta cells. And the autoreactive T cells are valuable for studying diabetes related processes and predicting outcomes of islet transplant. Scientists have also realized that T cell therapy can be the way to go when it comes to stopping this disease. There are still many questions about T cells, like why its tolerance to isolate autoantigens are lost, and how it's involved in the specific autoantigens in the disease progression and initiation of type 1 diabetes. Autoreactive T cells are actually very valuable, like I mentioned before, for studying diabetes-related processes, and predicting the outcomes of islet transplantation is crucial because T cells can both exacerbate and regulate this disease process. Next, we're going to talk about the receptors. So the main receptors in type 1 diabetes are T cell receptors. They also respond to toll-like receptor signaling. We'll talk a little bit more about that later. They play a major role in how CD4 and CD8 plus cells work in the development and balance of the body and how they fight infections. So T cells attack insulin-producing cells in the pancreas. This messes up the body's tolerance mechanisms and causes it to freak out. Type of TCR signals shape self-reactive T cells, which push the type 1 diabetes forward by influencing gene activity, cell type, and the harmful actions of those T cells. These receptors also motivate thymic development, peripheral homeostasis, effector subset differentiation, function, and memory formation. Type 1 diabetes also responds, like I mentioned before, to toll-like receptor signaling, and is also involved in the pancreatic islet infiltration. Now let's talk about what innate cells play a role in type 1 diabetes. Both the innate and adaptive system play roles in type 1 diabetes development in activating and expanding the antigen-recognizing T and B lymphocytes. The innate cells are responsible for initiation of autoimmune processing, which results in the eventual destruction of beta cells during the type 1 diabetes pathogenesis, to the ultimate damage of self-insulin producing pancreatic beta cells. And the innate cells that are mostly affiliated with this are macrophages, dendritic cells, and natural killer cells. They have been detected in the pancreas of patients that have been found with type 1 diabetes and have also been linked to the involvement and protection against this disease. Okay, now let's talk about cytokines. Cytokines are involved with the arranging of the complex multicellular interactions between the pancreatic beta cells and the immune cells. There are good and bad effects of these cytokines. The good effects are that IL-10, TGF beta cells, and IL-5 cytokines can calm down the immune system. IL-6 and TNF alpha cytokines can make the inflammation worse, and IL-2 cytokine can do both. Pancreatic cells have receptors for these cytokines and can be damaged or repaired by them. The interplay of these cytokines contribute to the start and progression of type 1 diabetes. Due to changes in the gene and protein activity, these pathways can cause an increased expression of certain proteins like HLA, class 1, and inhibitory receptors such as PDL1 on cell surfaces. Okay, so now let's talk about some symptoms of type 1 diabetes. They can either be found in the central, eyes, gastric, urinary, respiratory, or systematic systems of our body. It includes the chronic inflammation of pancreatic islets of Langerhans, and the high blood glucose levels can damage tiny blood vessels in your nerves. This can cause a tingling or burning pain that spreads from your fingers and toes up through your limbs. Some other symptoms include feeling more thirsty than usual, urinating a lot more, feeling very hungry, losing weight without trying to, hyperventilation, nausea, abdominal pain, feeling irritable or like having intense mood swings, feeling tired and weak, and having blurry vision. So, how to diagnose this? There are many different methods on how to diagnose, like fasting plasma glucose, oral glucose tolerance test, A1C, random glucose test, and the most common one used is the blood test. There are also other methods for diagnosis, but these are just the main ones used. The blood test is kind of self-explanatory, but for fasting plasma glucose, this involves checking your blood glucose levels after having nothing for 8 hours, so you have to fast. Normally, diabetes is diagnosed if your glucose level is 126 milligrams or higher. For the oral glucose tolerance test, this checks your blood glucose levels before and after 2 hours after you drink a sugary drink. This helps to show how your body responds to the glucose, and they will normally diagnose you with diabetes if your glucose is over 200 milligrams. For the A1C test, it tests hemoglobin, measures your average blood glucose for the past 2 to 3 months, and they will diagnose you with diabetes if you have a 6.5% or higher amount of glucose in your blood. The random glucose test is at any time of the day, and normally they will diagnose you with diabetes if you have 200 milligrams or higher. Treatments for type 1 diabetes include taking insulin, counting carbohydrates, fats, and proteins, monitoring blood sugar often, kind of using this little thing right here, eating healthy foods, exercising regularly, and keeping a healthy weight, keeping blood sugar as close to normal as possible. There are many types of insulin, like short-acting insulin, rapid-acting, intermediate-acting, long, and ultra-long insulin. People with diabetes need daily injections consisting of long-acting insulin and rapid-acting insulin. Needs of the type of insulin used varies on the person, and there are different methods now that people can use to live a more normal life. Like, as you can see up here, there's this little machine that is stuck onto the person's body with a little sticker, and it releases insulin at a certain point of the day. Of course, they continue to track their blood sugar throughout the day as normal and just making sure that everything is okay. Physicians can also recommend other methods of treatment other than insulin, like high blood pressure medications, aspirin, drugs that are used for lowering cholesterol. However, there are some other issues that come with this. Insulin is not always available. In the past years, there has been multiple insulin shortages that have impacted a lot of people. Insulin has also gone up in pricing. A lot of times people with diabetes won't have insurance, so they will have to find different ways of acquiring this. Okay, so now let's talk about research. Thankfully, type 1 diabetes and diabetes in general is one of the top things that people like to research. They're trying to find potential future treatments like pancreas transplants and islet cell transplantation, identifying type 1 diabetes before the beta cells are lost, and how the components in blood or tissue can measure to predict if that person can develop type 1 diabetes. They are also researching beta cell replacement in both type 1 and type 2 diabetes that result from a complete or partial loss of beta cells number and function. They are also working on enhancing survival of beta cells for successful transplantation. How diabetes can lead to blindness. They are discovering how diabetes changes the kinds of proteins that are made in our eye, and these changes can lead to diabetic, a leading cause of blindness. Okay, thank you.